Would you believe me if I told you that one of the most common nutritional deficiencies in UK children could be silently affecting your child's energy, behaviour, sleep, and even brain development? I'm talking right now. Iron deficiency is quickly and quietly becoming a crisis, and many parents don't even know that it's happening. I'm Dr. Candy Ejiofor. I'm a GP, but I'm also a mum to 3. And today, I'm breaking down what you absolutely need to know about iron deficiency anemia in children. So let's start with this fact. A 2021 UK study found that 1 in 4 toddlers were not getting enough iron from their diet. That's huge, that's 25%. And it's not just about feeling tired. As I said, iron is crucial for brain development, especially in children under age 5. Without it, children struggle with attention and learning, mood and behaviour, physical growth, sleep quality, and much, much more. In fact, a 2023 report by the British Nutrition Foundation found that iron deficiency in early life can have long-lasting effects on cognitive performance, even into school age. And this isn't something that we just grow out of. So there are a few reasons why this is happening, especially in the UK. So let's get into it. We know that UK have a high diet in ultra-processed food. Lots of kids are eating snacks and meals which are just low in iron and high in sugar and refined carbs. There's also too much cow's milk. Did you know that drinking more than 500 mils of cow's milk a day can actually block iron absorption and also just fill up kids so that they eat less iron-rich foods? And yes, we're having more plant-based eating, but that's great for the planet and much more, but non-heme plant iron isn't absorbed as well unless it's combined with vitamin C, and a lot of people just don't know that. And then we've got our fussy eaters, especially in toddlers, who may avoid meat and certain vegetables altogether. Here's what to look out for in terms of the symptoms. So tiredness, pale skin, shortness of breath, poor growth, poor appetite, frequent infections, craving strange things, which is a condition called pica, like ice, or non-food items like paper or sand, and struggling to concentrate or learn. And here's the scary part. Some children have no symptoms, no obvious symptoms, until it's severe. That's why it often goes undiagnosed for months, if not years, actually. According to Public Health England's NDN's data, iron intakes in children aged 1.5 to 3 years age are 35 to 45% below the recommended amount. And amongst teenage girls, over 50% have low iron intake, which is shocking, but that's a whole separate topic. Research from the University of Bristol's ALS-PAC study showed that children with low iron at age 2 were more likely to have behavioural problems and attention issues at age 4 or 5. So this isn't just theory, this is real world impact. Studies have also shown that chronic iron deficiency in early childhood can lead to lower cognitive scores even into teenage years. There's an increased risk of ADHD-like symptoms, with kids with low iron are more likely to have trouble focusing, controlling impulses, and managing emotions. And then they also have weaker immune system. Kids with iron deficiency get sick more often and recover slowly. And so there's evidence from the WHO and UK studies that treating iron deficiency early really improves that mental and physical development outcome. So what can parents do? What's the solution? Where do we start? Let's talk about that. The most important thing for me is to include iron-rich foods in their diet every single day. Especially, if you eat it, red meat, small portions are okay from, a little bit older. I would say 1, but I think guidance says 6 months. Eggs, beans and lentils, fortified cereals, leafy greens combined with vitamin C, like orange slices, to really boost that absorption. That's all really important. And then I would avoid too much milk, limit that to under 500 mils a day of cow's milk over the age of 1 year old. And then pair plant foods with vitamin C. Think lentils and peppers, or cereal and strawberries, because that really helps boost that absorption. And, get tested if you're really worried. Your GP can definitely check a child's iron levels with a simple blood test. But I wouldn't personally advocate testing every single child because it's not necessarily a nice process unless symptoms are severe or notable. Supplements are sometimes needed, but I would discuss this again with healthcare professionals because over supplementing can cause stomach pain, constipation, and iron toxicity. Definitely want to avoid those. So try and make those iron-rich meals, kid-friendly. Blending spinach into smoothies, adding lentils into your pasta sauce, cooking in a cast iron pan, which actually really boosts the iron in food. Okay, so the real is, as a mum, I know how easy it is to get caught up in the picky eating and the busy schedules and just trying to do our best at life in general. But this, I would say, is one of those things where a really small change early as well can make a huge difference overall. So just a few tweaks to your child's diet today can really protect their development, their health, their learning, and even their happiness tomorrow. Let me know your thoughts in the comments. Have you ever had to deal with iron deficiency in your child? What's worked best for you?